Hi guys, my name is Colette, and this is a quick video for Nursing 564 Contemporary Healthcare Environment for Gonzaga University. This video is about nursing and my nursing and healthcare philosophy. I just want to start out by saying a little bit about myself. I've only been practicing nursing for just a few short years. I was a late student and started nursing school in my late 40s, with my BSN. I graduated with my BSN and when I was in nursing school, I didn't really know what I wanted to do. And so when I did all of my rotations, I paid really close attention to where I thought that I might actually fit. And so for me, I was actually a little bit surprised when I realized during my clinical rotations for psychiatric mental health that I loved it. And so I think that some of that probably was because I have a strong family history regarding mental illness. My mother, my sister, my brother, and also one of my daughters that has had psychiatric mental health issues. And so I was, I think, greatly surprised when I felt like it was something that just sort of seemed to come naturally to me. And so that being said, I am in the doctorate program at Gonzaga, pursuing my psychiatric mental health nurse practitioner. I think that when it comes to any kind of nursing, really, I think all nursing has a foundation of mental health. And so the nurse, I think as nurses, we treat holistically, which definitely means treating the whole person, including their mental health, regardless of why they might be in our care. I think that we need to always remember those fundamentals when it comes to psychiatric care, whether it be treating the patient's family when someone is in our hospital care, maybe they're extremely sick or terminal, I think psychiatric nursing really comes in to play more than we really think that it does. And it's definitely important to remember those fundamental concepts of psychiatric mental health nursing. So I work in an inpatient unit at our local hospital. Along with that unit, I also work in a unit, a co-unit there, which is a medical withdrawal unit. So anyway, I love every day that I go to work. I feel like it was something that called out to me, and to be true to myself, I have pursued that and will continue to pursue my nurse practitioner role. I have stayed in my community because it's an underserved community here in Washington. And I think when it comes to my philosophy of nursing, I think that some of the things that are most important to me are access to care. Whether you have the ability to pay for care or not. Psychiatric and mental health issues is something that it's not always been, I don't want to say approved, but that has been supported by insurance companies until lately. I believe that psychiatric mental health nursing is or psychiatric mental health care actually, as a whole, is pretty much in its infancy when we think about medical care in general. And so we still have a lot to learn about psychiatric mental health care. But in the state of Washington, where I live, it's become something that has been a focus from our governor, and there's a lot of facilities that are opening up within our communities to try and get care closer to the community and closer to families where people need care. And so I work in one of those units that was put in the community. I work at a small community hospital, and so our our patients have access to their families, or I should say their families have access to them, and we can I think we have a better way of supporting them, not just within our facility, but when they leave, and we can give them the tools that they need to create their best life, their healthiest life, which is what we do as nurses, right? So we help them to reach their optimal health. And so that's something that's really important to me. So access to care, I think when it comes to my philosophy with nursing, is to treat them holistically. And when it comes to healthcare in general, access and equity of care are the things that are most important to me. So I think that's it for me. I will talk to you all soon. Thanks.